All right, so let's talk now about a blood supply to the brain, aka cerebrovascular system. So it's the circulatory system and the blood vessels that supply freshly oxygenated blood to the brain that keeps the brain alive. The cerebrovascular system also helps remove metabolic waste from the brain, and this is the byproduct of just the cells doing their work. And the brain uses a huge amount of oxygen. So the brain is only about 2% of your body weight. It's about the size of a grapefruit. And yet it uses 20% of the oxygen and glucose that your body takes in. And when we say the arteries or the arterial system, this is the freshly oxygenated blood being pumped away from the heart. The veins or the venous system, this is the system of blood vessels bringing oxygen poor blood back to the lungs and heart to be reoxygenated. So we use the word perfusion to refer to the transmission of blood down to the tissue of the body. And if you'll remember back in middle school or high school, at some point, you learned how blood vessels, arteries coming away from the heart start very large, so at the aorta, and then they break down to arteries and then arterioles, and they get smaller and smaller and smaller until they're at the level of the capillary. And it's at the level of the capillary that the oxygen and the nutrients in the blood cells detach from the blood cell, pass through the wall of the blood vessel to provide nutrients and oxygen to the cells of the body. And also at the capillary level, the waste products of the cells of the tissues of the body pass into the capillaries where they're picked up by blood cells. And then those waste products are passed through the capillaries into the venous system. So the capillaries start coming back together, getting bigger and bigger and bigger, eventually becoming venules and then veins, and then being transmitted all the way back to the heart and the lungs for reoxygenation. When you have an interruption of blood flow to the brain, this is referred to as a cerebrovascular accident or a CVA. And what we're talking about here is a stroke. There are primarily two different categories, different types of stroke. There is the hemorrhagic CVA, or the hemorrhagic stroke. This is when you have a blood vessel within the brain, an artery, that's going to burst due to high blood pressure, or maybe a combination of high blood pressure and there being a weakness in the wall of the artery. And when this happens, you're going to have a damage to the brain where that blood flow is exiting the cerebrovascular system and pouring into the raw tissue of the brain. Blood is meant to stay within the cerebrovascular system. It's not meant to just pour anywhere it wants to within the brain, because when that happens, that damages the tissue. And this makes sense because if you think about your brain, it's basically like a fine electrical instrument. There's a reason you don't want to drop your iPhone in the toilet. It's because it's not going to work anymore, because electronics and fluids don't mix. And the same with your brain. Also, when you have a hemorrhagic CVA, so you have a blood vessel burst, that is the hemorrhage. If a blood vessel bursts, then you have blood flow pouring out into the brain where it's not supposed to go, but it's also now not passing appropriately through the artery itself, getting to where it needs to be in the first place. So there's two ways right there that hemorrhagic CVAs create brain damage. Putting blood outside of the circulatory system to damage brain tissue, but also depriving part of the brain of freshly oxygenated blood flow that it needs to survive and function. A third way that hemorrhagic stroke damages the brain is that if you have blood pouring out of the circulatory system, it's eventually going to create a pool of blood in the brain. And if it keeps getting pumped in there more and more and more, that pool of blood is going to get bigger and bigger. And this is known as a hematoma. And if you can imagine, if you took a water hose and stuck it in my head, turned on the faucet and started pumping fluid into my head, it's not going to be long before the pressure within my head gets too high for my brain to survive. And that is intracranial pressure. Intracranial pressure is the amount of pressure within my skull that's exerted on my brain. Increased intracranial pressure is a bad thing because that's going to crush my brain within my skull. It's the same mechanism that we discussed when we talked about hydrocephalus. Symptoms of a hemorrhagic CVA are very different from other CVAs because it usually happens quite suddenly. There is a sudden onset of a severe headache. There is sudden alteration in the level of consciousness. So a person can go unconscious quite immediately. The symptoms tend to be more sudden and more dramatic than an ischemic CVA. An ischemic CVA is when there is an occlusion within an artery within the brain. And when there is an occlusion, or that you have sealed off an artery within the brain, then that is going to stop blood flow that is going out to a part of the brain. That's going to deprive that part of the brain of freshly oxygenated blood, and then that part of the brain is going to cease to function and will soon die. If the occlusion within the artery is formed by a particulate that is traveling through the bloodstream, we call this an embolus or an embolic CVA. So if I have knee surgery, throw a clot. So they have some blood that clots in my knee, but then gets sent along the venous system back up to my heart, where it passes into the arterial system and then gets sent up to my brain, where it lodges within an artery within my brain, clotting that artery, depriving part of the brain of blood flow. That is an embolic CVA. When you have a buildup of fats and cholesterol within your circulatory system, this is known as atherosclerosis. It can build up on the walls of the artery and slowly occlude the arteries. And eventually you'll get to a point where one of the arteries will be entirely occluded. So in this example here, I'm circling, put an occlusion there. It slowly forms, and eventually that last little bit closes. That is a thrombosis. So in the case of a thrombosis, the occlusion is at the place where that clot has formed. Nothing is traveling through the body. And when that occlusion finally occurs, then once again, part of the brain will be deprived of freshly oxygenated blood flow and will cease to function and will eventually die. So it's true that part of a thrombosis can break off and travel within the bloodstream, becoming an embolus. And if that embolus lodges somewhere, creating an occlusion within an artery within the brain, it becomes an embolic stroke. The symptomatology of ischemic CVAs tends to be different from hemorrhagic. Probably when you think about stroke symptoms, you think more about ischemic CVA type symptoms. And one of the reasons for that is most of the strokes that happen, like 9 out of 10, 9.5 out of 10 strokes that happen are ischemic strokes. So this is when like one side of your body goes numb or slowly begins to feel tingly, or you start having vision and balance problems. You have the sudden onset of difficulty articulating or finding your words. And also, hemorrhagic CVAs, they tend to occur in periods of high physical exertion. So up north, lots of old men have strokes after big snows when they're out shoveling their driveways. They're out there and they're cold, so they're not sweating a lot, they're not feeling too hot, they don't feel like they're overworking themselves, so they keep shoveling, raising their blood pressure more and more as their heart rate increases until eventually that heightened blood pressure breaks through a weakened wall within an artery within the brain. The last ischemic CVA that I'm going to mention here is a transient ischemic attack, also known as a TIA. People often call these mini strokes. They last from about minutes, maybe up to 24 hours, but your body resolves the clot naturally. And after the TIA, there's no significant permanent damage to the brain. That is at least discernible. Now, if you have lots of TIAs, then you will accumulate noticeable damage to the brain and significant deficits that come along with that. So TIAs tend to not be a big deal in themselves, but they tend to predict an larger oncoming stroke. So even though someone may be having TIAs, doctors still worry about them a good bit because that means that they are predisposed to having a bigger stroke coming down the line. All right, so now let's talk about the ischemic core and the ischemic penumbra. When you have an ischemic stroke, when you have an occlusion of an artery within the brain, that artery is going to be feeding an area of the brain. Some of that area only gets blood flow from that artery that is now occluded. That tissue, being completely deprived of freshly oxygenated blood, is going to die quite immediately. It's going to die within 4 to 6 minutes, and it's not coming back. It is dead and gone. We refer to this as being the core, the ischemic core. Sometimes you'll hear people refer to this as the infarct. Now, surrounding the infarct, there's going to be tissue of the brain that has been deprived of oxygen because of that occlusion. So it's getting less blood flow than it was getting. It's not getting enough blood flow to function, but by virtue of other blood vessels that it's getting collateral blood flow from, it is getting enough blood flow to survive for the time being. So this is the part surrounding the infarct that doesn't die immediately. It's not functioning, but it's not dying. It's staying alive for the moment, and that is known as the penumbra. So there are parts of the penumbra that can survive for up to 8 hours, only getting collateral blood flow. So it's not getting enough to function, but it is getting enough to survive for the time being. But as time goes by, if this patient does not get prompt medical treatment and resolve that clot and reestablish blood flow to the penumbra will slowly die more and more, creating a larger and larger core. So the functional outcome of this is if someone has an ischemic stroke, so there's an artery within the brain that has an occlusion, within 10 minutes, they're going to have cell death, depending on, and the size of the core is going to depend on the size of the artery that has been occluded. But the sooner they can get to the hospital and get medical care, the sooner blood flow will be reestablished to the penumbra, thereby allowing much more of the brain to survive, thereby meaning this person is going to have fewer permanent deficits as they move forward in their life. For someone that waits to go to the hospital, that core is getting larger and larger as the penumbra dies. So if you have someone that waits, we'll say all day before going to the hospital, they may go in then and resolve the clot, reestablish blood flow, but most of the penumbra may already be dead, creating a much larger core, creating way more deficits that this person has to deal with for the rest of their life. So it's very important when someone starts having a stroke that they get to the hospital as quickly as possible so that as much of the ischemic penumbra can be saved as is possible to make sure that these people have the lowest amount of permanent brain damage and therefore deficits moving forward. So when any tissue of the body, if it is completely deprived of oxygen, we call that anoxia. If it is somewhat deprived of oxygen, we call that hypoxia. And the brain is very sensitive to anoxia and hypoxia. If you interrupt any of the pathways primary blood flow to the brain, your internal carotids or your vertebral system, and I'm going to talk about this in a minute, within 5 to 8 seconds, you can be completely unconscious. If the brain tissue is completely deprived of oxygen, then within 20 to 25 seconds, those neurons have stopped functioning. They've entered into electrical silence, meaning that they're not talking to one another. And 4 to 6 minutes, as we already said, creates the ischemic core or the infarct. Prompt medical treatment is going to focus on reperfusion of the affected area, which is going to be the penumbra because the core is already dead. So reperfusion means reestablishing blood flow. And some areas of the brain use more oxygen than others. And when you deprive the brain of oxygen, those areas that use the most blood are going to be the first parts of your brain to die. So let's say I have a heart attack. Blood flow stops moving, blood stops moving into my head. The two areas of my brain that are going to suffer first are the cells of my hippocampus, and this is the parts within my temporal lobes that encode memory. So it moves experiences into short and long-term memory. And also the part of my brain that connects my cerebellum to the rest of my central nervous system, and those are known as the Purkinje cells. If I deprive the Purkinje cells of oxygen and they die, then I have disconnected in large part my cerebellum from the rest of my body. My cerebellum is what allows me to move in a coordinated and error-free fashion. So if I had a heart attack and there was no blood flow going to my head for long enough, The cells of my hippocampus and Purkinje cells connecting my cerebellum to the rest of my body are going to be the first things to die. Let's say someone gets to me, performs CPR, maybe has a defibrillator, brings me back to life, but my hippocampus cells, my Purkinje cells are dead. So those will be separate cores of damage within my brain. I'm going to not be able to create new memories, and I'm not going to be able to coordinate my movements very well.